Welcome to our Therapist Thursday. Consuela, we're great. Just excited to have you here as our therapist we're featuring today. So, I want you just to tell a little bit about you as a therapist and what your business is that you're doing, and then we'll get back into more details as we go along. But just kind of introduce yourself a little there.
Okay, well, I am an LSU graduate of LSU Medical Center, now called LSU Health and Science Center in New Orleans, and have been a therapist for 30 years. And of the 30 years, probably 26 years in home health exclusively. So a lot of my experience is just going into individual homes and surprisingly working primarily for one home health agency. Now, during that time, if other ones needed me to pick up one or two here or there, I did, but 90% of what I did as a home health therapist, I did it with one company and did it in an area probably 20, 25-mile radius in either direction, and got to know my residents really well and
Mhm.
had many of them several times, and even a different generation of the same family, and just loved home health. And in 2021, I wanted to do something different, because even in serving the needs, I just felt that there were things I couldn't tap into, things that didn't fit under what I wanted to do with the family. And then I was thinking about this, PDGM,
Yes.
that had a big factor in me needing to leave home health because things started to be different with the agency not understanding how that model worked. And it was sort of minimizing OT's role and making us an add-on if needed and delaying OT until another discipline was completely finished and putting the patient at a disadvantage and just a lot of little things that I didn't like how things were turning in home health. And then the um, Medicare Advantage plans were overwhelmingly bombarding my community, and the amount of OT visits that were being approved under the Medicare Advantage plans was greatly diminished. And
Hmm.
I found myself so frustrated because I was not able to achieve the goals of my patients and several other little things, but those two major components made it necessary for me to do something different. So launching, finding a foothold, became um, my choice for continuing how I do OT.
Great. Yeah. So, what really inspired you then? Because you're in the homes all the time in terms of home modifications, because I know that's kind of that fall prevention is where your focus is now, right?
Yes. Hmm. So
And so,
what,
so
what's
what
the question?
motivated you that way? Because you've talked about seeing clients in their home, but people still see clients in the home and don't focus on home mods or falls very much. And so something
Yes.
pushed you there.
Just the overwhelming um, incidences of seeing my patients in the home health setting were because of falls. And not only one fall. As I said earlier, I often saw the same clients
Mm-hmm.
for different reasons, but many of them because of the same problem. They had another fall in the home. So I found the need to really focus on that. That as an OT, we can do a whole lot, and we why not encompass more of an emphasis on preventing some of those falls, which would in fact result in a patient becoming more independent and having more an ability to stay in their homes longer.
Absolutely. And when you're seeing patients again and again, you can see how each fall makes it harder for them, right, to live their life. And so that's kind of a reason to look at preventing it. So, what were some of the hesitations or misconceptions you had before starting to look at fall prevention, home modifications, and your own practice?
Well, I would say it from the standpoint of how I addressed um, fall prevention.
Hmm.
I initially thought you had to address it textbook remedies, solutions, that it had to be the tub bench. It had to be a certain type of equipment that is popular and commonly introduced to patients in the home health setting. Had to be a standardized grab bar that you put in, that more of a sterile approach to home modifications, and it did not fit for the a certain population of the people that I was servicing. I live in an area, and if I turn down and go one direction, I'm in going into a more affluent area where there is no barriers to getting things. As we
Hmm.
know, insurance doesn't fund many of the things that we need in the home health that patients need in the home health setting to improve function and improve safety. And then just turning the other opposite direction of a turn out of my driveway, I'm headed into the area where increasingly the means are not there, the funding, the resources are not there to obtain devices and to do modifications in a what we term is a customary way of doing home modifications, and where home modifications and fall prevention were deemed as out of reach. Like the moment you say, well, look, we need to talk about some things you need to do different in the home, the wall automatically went up because I was beginning to see that they saw that this doesn't pertain to me. And it was like a glass wall went up. They heard me, but they didn't internalize it because they didn't see how it was attainable in their environment and how they could get their environment to look like something that looks like our textbook. And over time, I saw that as a major. I hope I'm answering your question because that's what comes to my mind
Yeah.
in how I approached it and how I now saw I was doing a disservice to many of all of my clients, because even the ones with affluent means, that doesn't mean that they felt that they needed to make those changes. That I
Hmm.
don't know, I don't need all of that, so I'm not going to do anything. So in crafting an approach on both sides that makes a patient realize that home accessibility is both affordable and relevant became my focus, because if I can't get you to see that this is something doable for you, you're not even listening, you're not even entertaining the thought of making things safer. And it made me have a responsibility to present it in a way that you can take from it the portions that you are able to do. And I had to walk away from the standpoint of, um, if they can lower the risk, I've done my job. If I can do something within the
Yeah.
means that they can afford, I've achieved what I can do. And I can not walk away from there frustrated because they couldn't afford a tub bench. They couldn't do that. When I now know other ways that may not be customary, but if they deem that they are safe and I can qualify and write my note in a way that protects me, but protects them in the way of saying this is what they opt to do within their means, and I deem it safe, it may not be the customary way to do it, but it met the need that they had and evoked some type of a change that lowered the risk for them.
Yeah, I'm thinking it goes back to when we think about all the clinical reasoning components, right? Client-centered reasoning, pragmatic reasoning, pulling all of those in, the social cognitive bit, but it's also like we have to step out of our perspective and start to look at it from the client's perspective. What are their priorities? How is this going to work for them?
Mhm.
Now, when you're doing that, I'm sure you had some very rewarding experiences. So, what were some rewarding experiences that have kept you focused on home mods or that you've seen?
Oh, so many, so many. I could go from even from a caregiver standpoint, when I can reduce the incident of an injury of a caregiver by introducing a technique or a piece of equipment or a modification that they can put in place. Uh, that's rewarding because I had seen so many injuries of the over the years when I was working with maybe the grandmother when I was fresh out of school. And I remember that house. I remember that
Hmm.
grandmother, and I was working with that daughter at the time and saying, "Oh, please don't have your grandma, your mother grab you around the neck. That's not good for you." And she's saying, "Oh, but that's the way we do it. I'm okay." And I'm like, "But it's not in your best interest. Over time, you're going to cause areas in your back and in your body that are going to hurt you." And then I go 10 years down the line. I have the
Uh-huh.
same client, the daughter, the mom has passed away, and I see that daughter who has now had multiple neck surgeries and don't remember, well, yeah, they remember. They kept saying, "I remember you telling me, don't let
Yeah.
mom grab me around the neck." And
Wow.
those things stick with me, that if only I had tried harder to really come up with other options, but I might have been stuck in my mind with what are the options. But over the years and over the experience, I can flip to another story and I can say for certain that caregiver's life was forever changed or not diminished in their quality of life because I did put in place one little thing, and I can remember this. Their bathroom was really, the house was constructed probably not too cold, that it was probably an add-on bathroom that nobody really went downtown and
Officially knew it was there.
yes, so it wasn't really too cold. And there was no places to put grab bars. I mean, it was like pretty much hollow walls, and there was no place. And the little places that were sturdy, you couldn't put up the little round
Uh-huh.
grab bar thing that has like the four places. And
Yes. Yep.
you're gonna get that in there. So one day I was just thinking, I said, we gotta think of something. And it occurred to me that we could get a screen door handle. Can you
Uh-huh.
picture an old-fashioned screen door with one of this little one thing? I said, look, I'm gonna go to the store and we gotta find one where your fingers can get behind the seat. If you got it on the wall like this, we gotta get it where your hand can get in there and you can grab. I remember putting that in a location where she was sitting on the toilet, that she could put her hand up in there and she could put her, look, we worked on it, and it was like a miracle that I found like a 399 device, and I put that little thing on the wall. I put it there. I told her husband, have somebody screw this right here. And I came back the next day, the next visit, it was there. And they thought I was a genius. But what it did was it helped her to be more independent with toileting. She was not going as frequently as she could because she hated to bother her husband, who liked to be outside, sitting under the tree around the corner with his friends. So she wouldn't go to the bathroom on a timely manner because she couldn't get up. And the toilet wasn't conducive to putting on any type of devices
Yes.
just because of the structure of the floor and a lot of things that made it like, this is not the safest bathroom, but it was the
So doing
only
the
bathroom
yeah, so doing the best option that you could.
good for them. And those little stories are like, I got to keep thinking outside of the box for patients. And I stopped using the word home modifications because it just sends a red flag to certain people because it has never been presented in a way that valued who they are and what they have and what they call home. And it makes me resist the going into a home and say, you need to remove this.
Mm-hmm.
when they worked for that, when they value that, when that is something that makes them feel like this is part of their home, and then it becomes this rug right here. This is my language changing. Let's look at putting this in a different spot because where it's located, it's gonna cause trouble for you. You can easily fall. And changing my language when those sofas are worn out, like it's been in that house for generations. The floral sofa with the little skirt on the bottom, they brown and orange. Y'all can picture them. They're in
Yes.
every picture on their wall. It's a family member. It's been there in the home. It like probably can be written off on their taxes because it's been around like a dependent. And for me to say get rid of it,
Mm-hmm.
I've learned not to do that. It's just things like value what they have. But let's see how we can make this sofa look a little bit different.
Well,
Let's
and it's
see.
it's and it's almost like inviting them to help you problem solve. Yeah,
Yes.
that shared decision making. And when we look
Yes.
at the research, that's so important,
Yes.
right? If we want
Mhm.
it to actually have meaning and be used.
Yes. And nobody wants to be told what to do because what it does, it negates everything that has been their life. You mean to tell me I've been having this sofa all this sofa for all of these years, or this bed has been this height, and I've been doing it this way, and this girl gonna come in here and tell me this and
Hmm.
that? It, it
Yeah.
doesn't it doesn't work. So when I think about home modifications, I wonder, am I doing it all right? Could I be a little bit more sophisticated about it? Can I make it look a more glamorous, like I'm getting out the magic toolbox and I'm looking all. It works if it needs to work that way. And in certain clinical settings and in certain things when maybe I'm getting a referral from somebody who has means, who's had a industrial accident
Yes.
and they need hard data on things and things that can be accommodated for or can be funded, then I can go with for that approach. But my heart is to serve the people who are repeatedly falling, who want to do things to improve safety, but they don't have the means. And so trying to connect them to means and help them is my desire.
It's really interesting because when we look at the research and we look at the studies, it's not the big architectural changes that really make the difference.
Hmm.
It's often the small things. And so even when we look at those grants and those fundings, that your experience is just reinforcing what the research has shown, and particularly for this population. That's very different to someone with a traumatic injury versus
Yes,
someone who's aging in place with chronic conditions.
yes.
Now, you took our chat certification, the Certified Home Accessibility Therapist.
Hmm.
What did you get out of that, and how has that helped with what you're doing?
Oh my gosh. So it's been very, I won't say invaluable, but I don't think that doesn't diminish it. I wanted to say in a way is that I can't put a value on it that really expresses how much it has improved or broadened my scope about home modifications, especially the components that have to do with architectural construction part of it. That part, I learned a lot in that area because that was not my cup of tea or my wheelhouse, as people say now, in knowing like you can come off the top of your head with like, oh, the standard bathroom is this side, is either going to be a this or is either going to be a that, and then and how's it. I didn't know all of that, and I still don't know it, but I know how to go to it. If nothing else, very invaluable of setting a framework of why we do what we do. Gave me tons of information about housing and where housing has been stuck in what we are living with today as a result of past things, and how to move forward into making things more accessible where people can be safer and more functional in their homes. And just all the tools. It's a resource. So whenever I'm like, there's a chapter in that, let me go look through my downloads and find that, because now I feel like I have a place to go instead of Googling aimlessly trying to find something I need. I feel like the chat gave me like a library of tools and
Oh,
resources.
that's really good. I'm glad to hear that. And then, as we update it, of course, get the
Hmm.
updated ones and stuff that's there. Um, the other thing is, had you done any other certifications in terms of home mods before this?
Yes, did the caps.
And how did the chat compare to the caps for you?
Very more OT focused, and with a lot, it just has that medical component. That component that, yeah, gives you some similar information, but then it builds up on it, because now we are putting into that construction our knowledge and bring into how we can effectively communicate our thoughts to that person who is the builder, who is the construction person. And I love the fact that it is professionally based and specific.
Oh, Consuela, I think you froze.
Yeah. Mhm.
Um, but I love that she was saying that the chat is very therapist focused and very specific for that. Hopefully, she'll come back shortly because I want to ask her where she's going now. Because I know Consuela's passion has been for the people in her community that she talked about that doesn't have resources. And she has just set up a nonprofit. And I want to talk a little bit about that with her. So I think she's going to be coming back in. But Rita, having listened to what Consuela has said so far, what are your thoughts?
Well, I actually love her thoughts about, dealing with people that, don't really have the means to get the regular things from Amazon. What sometimes we think is very affordable isn't affordable to some people. And, in North Carolina here, we have a lot of people like that. And we also have a lot of people that standard grab bars and things like that might not work for them because of trailer homes, mobile parks, things like that. So I think that take on it is really great. And then she wants to work in that space.
Mhm.
I am very interested in her whole using fall prevention as one of her major focuses.
Yes.
Yeah, so Consuela, I think there's a couple of things I'd like you to address now, and then we'll go on a little bit. But one, you did a book on falls and fall prevention that you use as part of your where you're going and what you're doing. And two, now that you've set up this nonprofit. So let's talk a little bit about the journey through both of those.
Oh, I didn't set out to do either one of them. Uh, I just felt compelled out of just frustration. Like I mentioned in 2001, I started thinking about the LLC, and started the work of not even doing Medicare Part B. It's just um, working with caregivers, because that was my heart.
Mhm.
Having coaching with caregivers on just how to deal with setting limits in regard to caregiving and protecting their bodies from injury, and evolved from that into still wanting to do OT. So toyed with doing Medicare Part B, and it wasn't my thing. I'll go ahead and admit it. I was so used to just being given patients through home health that having to go out and do that extra step of finding the patients and doing the billing, it just did not. I didn't make that adjustment as easily as I thought I was going to make it. And my heart kept going back to, even if I do, I still need to still be able to tap into being more an effective therapist. And because I knew what a fall did to every family, regardless of the means, it disrupted the entire family flow. And but it's more devastating when you have a family that can't stop working. Their mom
Mm.
fell and now she's in rehab and they're taking off work probably prematurely and staying at the hospital. They run out of days. I get there on the first day of home health and they're asking me when can I go back to work? And then all the family dynamics of who's staying at night on the weekend and just knowing that whole ripple effect that a fall has. And I have to say some of that is from experience too, because my mom, who's now passed, having to deal with those things in my life, um,
Mhm.
it was a struggle. And just to think for somebody who don't have skills to do it and then don't have the finances to do it, it just added so much struggle to that life. So while my company was making gains, I was always disappointed when it was somebody that could afford me. I mean, I was glad they could afford me, but I was what I thought the company was going to do was open up the means to reach that group of people, and it did not. But when they called and they would say, "Well, does Medicare pay for it?" I'm like, "No, because it's really not a skilled or a billable service." And I wasn't going out into the homes and it wasn't telehealth, so it didn't fit into a billable thing. And so they were still not getting my services, and or I was just doing it for free. Well, look, you're on the phone, on the call. What is it you need? And I just like was just, and I was loving it. A person on the end of the call asking for things about just in general safety. What are some things, and I can say like in general terms, I'm not trying to give them one-on-one sessions. And in fact, I started doing it as a group because I was steering away from giving one-on-one advice because I didn't want to slip into the therapist role. That I'm like, in general, for those in the room who are having this issue with this, these are some ways, and really
Mhm.
just enlarging in their understanding. But it didn't generate income for me, but I was having the time of my life. And then it dawned on me, you know what? I need to find funding for this. And then came the foundation. Like, who could I get that could pay me to talk to these same groups of people and tell them things that they need to consider when we're
Mhm.
looking at either caregiving or you're that aging older adult who have concerns about your living at home, or you don't have those concerns but your kids see it and they're telling you you're going to have to move unless you do
Yes.
something. So that's how the foundation started. So in January I started doing research, found the grant, and it didn't require I have a 501(c). So I said, you know what? I'm going to go for it, and I'll find a sponsor. It was the best thing I did. Not that I got the grant because I didn't,
I
but
remember helping write that grant.
yes. But I'm telling you, Sue, it opened up my eyes to the whole nonprofit world.
Community and who is in there that works in this space, right?
Right?
And
Who's
the
yes.
networking that
And yes, and that started the whole thing. Everything that Grant told me I needed to do, I'm like, I don't have that. I need community partners. What are community partners? So then I knew Sue was around. So I'm like, I'm going to consult Sue. I'm going to talk to this person in the nonprofit space and start talking to different people. Like, tell me about community partners. Tell me about initiatives. Tell me about goals. Tell me about evaluations. What is it that this grant is asking me? Because I don't know. But in that 2 month time, I did a lot of research on grants. And while I didn't do it, I mean, while I didn't receive it, and looking at who did receive it, I didn't have a chance because it went all to institutions, like of higher learning for the most part, like big organizations. It gave me enough drive to say, I want to formalize my own nonprofit. So I filed with my
Your
state,
501(c)(3).
and then I filed with the state to just acknowledge myself as a different entity. And then filed the application to get the 501(c)(3). And thank God I got it the first time. Well, I hired a consultant and she walked me through filling out the Form 1023, I think it's called. And then I got the approval for the nonprofit in August. So also in August, I started looking at how do I educate myself? I mean, I can keep consulting people, which I do, but I don't know if they're telling me the right thing. I don't know how to counter what they say with something that's based on what's in my heart. So in August, I enrolled in LSU's um, graduate school and I am now pursuing a master's in nonprofit administration. So I am currently in my second semester of that, and everything I'm learning is coinciding with me in helping me in just setting the stage. And last year was the foundation of getting the community partners. You talk about writing letters, making connections with other people in the community who are focused on senior health in older adults, partnering with like coalitions in churches that have
Hmm.
health-based outreaches, getting connected with them, getting connected with Baton Rouge Aging Networks, all types of organizations where healthcare people are coming together and making those connections. And I'm telling them, look, I'm all about keeping people safe in their home and as independent as possible by reducing the prevalence of falls. And they are all like, oh, we all need to hear this. And even yesterday I got invited to two events. I have spoken at different conferences in the local community, being asked to be on their panels and being not keynote speakers, but being speakers in breakout rooms where seniors are arriving at events, and I get to talk about fall prevention. So a lot of things are happening, and it all started with just taking, getting courage. Courage takes a lot of it to get out there and talk about what I do and own it. Just like owning that what I know works and giving them evidence, giving them testimonials, giving them thank you cards from families that are saying if we had not attended her sessions, mom would have been in assisted living instead of us making maybe a $200 investment in little things, and really emphasizing that fall prevention is just not about the home modifications. There are four pillars that I go through,
Yes.
and you have to do them all. You can make the home modifications and have everything in order. But if you have bad habits, making bad choices, then you're still going to fall, or you're still
Hmm.
going to have those fall risks. So it's just really addressing the pillars and really emphasizing the home modification piece, that it has to be something that you make accessible, making them see that this is a choice that they can make.
Hmm. Yeah, and I think, as you're moving through this nonprofit world now, you're going to be starting to apply for more grants and you're going to look at
Yeah.
ways to get paid,
Yes.
right?
And yes, and sponsorships. And look, and that's a good thing. Like I have two events coming up, and just going out and or sending letters to local pharmacists, local vision places, outpatient rehab facilities, asking, can you help sponsor this event? And putting their little logos at the bottom of that flyer. And I'm having them at senior apartment complexes. I'm contacting churches. I have one at a church coming up in March. And just getting the community to buy into what roles they can play in supporting the people that have been patronizing them for years.
Hmm. That's really great. And kind of pulling the community together to support
Yes.
everyone. And that's kind of been your passion. So what advice would you give to other therapists who are considering one, moving into home mods, and then two, potentially doing a nonprofit? So let's start first with moving into home mods.
It's what we do anyway. If we just go to the public bathroom, we're already doing a modification. We're looking, and we can't turn it off. If you're in any arena outside of the hospital, if you're in home health, you're already doing it. If you're in outpatient, you should be asking those questions about the home environment, because that's a gap that needs to be filled, and it could lead to opportunities to be into home modifications. Because one big thing that I see, and one big problem that I've seen, or a gap, is one group of our local orthopedic surgeons did not appreciate home health. Everybody that had a hip, everybody, if they were able-bodied and no real medical reason, they bypassed home health and went right to outpatient. But when you have friends in outpatient and you see that they are reporting that, oh, she fell when she went back home, like they making gains in outpatient, and then but no one's looked at the home environment, then that is a component that needs to be considered. So as OTs, you're doing it anyway. So think about a way that you can incorporate it into what you're already doing without making it look like, oh, I got to do this and this. Well, if you're doing home health, and that patient finishes home health, and you see that there was needs that you couldn't address because of limitations or whatever, maybe that's an opportunity to maybe come back and look at them as Medicare Part B, where you can do a more thorough assessment and really meet some needs that couldn't be met earlier. I think it's what we do already, so find a way to make it creative into what you're doing anyway.
Do you think some of it is that while we have a general knowledge, it's kind of that textbook knowledge. It's not until we actually do something like the chat that it pushes us to incorporate it a little better in what we do and more of those skill set with it.
Yes, yes. I mean, it does help, but I think you got to go back a little bit further. Also, you have to be exposed to environments that are different from yours.
Yes,
I
we make the
think,
assumption everybody does things the same way as we do, or comes
right,
from the same home as we
know,
do, or lives in the same
right.
home. And
I,
that's definitely not true.
I think having a home health base, for me, it helped. If I maybe had just only been in a acute setting, never have done home health, yes, I know the clinical skills because we all have the same textbooks. We all know about home modifications.
But the textbooks don't give you the advanced skill that the
They
certification,
don't,
and
and
they don't have you think that way. But also, we
they,
often make assumptions, right? That it has to look
right,
exactly like the picture in the textbook because that's how every house looks.
right. So I would think if it's something you really are thinking, I think I want to do it. I think getting more practical exposure to home environments and people, and making it helping you to make connections with a person and getting out of the textbook is is key. And I think
Yes.
OTs can do that because we're very diverse.
Mhm.
But I think you need to have that lens on first, and then I mean taking the chat certification does give you that heightened honing in on what home modifications are all about, versus what I was going to say earlier before there was some type of glitch here. And I'm not comparing programs. CAPS is CAPS, but when you got a group of therapists in a room and we're all talking the same language, that just goes over and beyond versus you sitting in a room with somebody who may have just a no background in medicine, don't know the first thing about medicine, don't know the first thing about a disability, that all they know is ADA, and we know as OTs that that's not what we use when we're in the home. And it just says I think chatting gives you a better use of your skills, allowing you to know all that stuff that's in your brain and how you can channel it properly when you're looking at meeting the needs of someone.
Yeah, and so I think I think that's really important. And I think you're reflecting too, even like our home safety pros group for the chat graduates, which you recently joined. That's given you another perspective of therapists chatting and talking too, right?
Yeah, exactly. Exactly.
Yeah. What's one myth you think you would like to debunk for therapists who are wanting to move into home mods or working in that area?
Maybe I think for me that you have to have a lot of tools.
Yeah.
And you have to know the people who's going to do the work. Eventually you do, but I think that's secondary. It's exposing people to what can be. And when you can go in and see what needs are, look at limitations, and you hear the heart of how they want to live their life as OTs. And we were just talking about occupations, just something in you wants that to happen for them within reason. I mean, we can't hang the moon, but when you're looking at things, you can reasonably say what level of that can be achieved. And as OTs, that's why we do what we do. And I think like right now, I really don't have a construction person I would call. I really don't. Unfortunately, I lean on the family members about that. And most of the time, it's within their own family group. I mean, it's going
Hmm.
to be the uncle. It's going to be the son that comes over on the weekend. I'm just taking pictures and leaving the possibilities for whenever you're ready to tackle this. These are some things that you all have to have in place. And I'm giving them links. I'm taking pictures of where I put some tape on the wall. In case it falls off, they have a picture of it. And I think for me, that was it. I don't know people who's going to help do this. And I was trying to fill that gap, and maybe that gap wasn't for me to fill. And so start where you are, and believe it or not, I'm getting people that I'm making a list of people that, oh, that son was licensed. He just never thought he needed to do it for his mom. You know how you can
Yeah.
see stuff for other people if you can't see it in your own house? And I'm like, look, will you be open if I made referrals to you? And he's like, oh yes. So I think don't wait to have everything in place. If you help somebody, you know more than the patient, you know more than the family. If they knew it, they wouldn't be calling you. You wouldn't see the incidents of falls. So value what you have.
Yeah, that's great advice with that. Rita, as you've been listening, do you have questions that have come up or things that you want to ask Consuela?
Well, I think I'm having a block at the moment, and I think that from what I gather, it's something that was hard for you too a little bit about getting started. I know that I want to reach out to these different organizations and I want to do these classes or maybe sponsorships,
Mhm.
what you're doing, but
I'm going to tell you
how would you word this?
the deadline for the grant push Consuela out there.
It does. It does. It does. When your back's against the wall, and I had to keep telling myself they need me just as much as I need them. What I feel is so valuable they need it. The people in the community need it. So you just have to be
Mhm.
able, as far as grant writing, communicate the outcome that you are hoping to achieve and find the measures by which to gather that information to prove whether you are attaining those goals or not. So changing my
Mhm.
mindset for, oh, I hope they call me for the grant, or, you're like, but I'm writing it with confidence because I'm learning to write grants. I'm doing the work uh, that shows them that this is a gap that needs to be filled, that nobody's doing this effectively in my area.
And also, going into individual places like around here, there are a lot of assisted living homes and things like that, and just adult, adult daycare and adult
Mhm.
things. And what I wanted to try to do was get involved with them and, like, sort of in a way pitching myself, but kind of pitching it in person, like going in and seeing someone and
Yeah.
them seeing me because of my disability. I don't know if you know that I have a disability, but I kind of market myself as I've been there, done that, and
Oh, absolutely. Yeah.
most of my people that I've worked with in the past are like, you get it. So if you
Right.
see somebody who has dealt with these modifications and dealt with these, well, falls and fall prevention and all that. So I was thinking about, like, what do you think? Like,
Well, for me, that was the networking.
okay,
Joining
okay,
networking organizations. Like,
okay,
we have one called Brand, and Brand means Baton Rouge Aging Network. I saw, I heard of them. I Googled it. I don't know how I was exposed to it, but I saw it and I saw that they had a networking event. So I
okay,
went to that event. The first couple of times I didn't say a word other than when they said, anybody new, stand up or introduce yourself, and I did. But I had my cards, but I was so shy, I didn't do anything. But I kept coming back. And they kept
okay,
remembering me, and then other people started saying, "Hey, we meet on the second Thursday. You want to come to ours?" And then all of a sudden, I'm going to all of these networking events, and then now they know my name, and I'm not really pushing too hard. But and then after they begin to know me, I started saying, "Hey, I would like to, may I come out and visit you one day, because I want to, like, really share with you a little bit more about what I do." Or I am, just finding a way of not bombarding them right away, but
hmm,
just showing that you know what you know, by doing outreach tables, resource tables in the same environment. So if there's a resource fair coming up, and for most nonprofits is very low cost or no cost to
yeah,
set up. And then while you're there, just getting this rapport with other medical professionals. And when they start trusting you, they start telling you about other things. So a couple of the speaking engagements that I've done was because of someone at one of the events said, "Hey, there's this girl that talks about fall prevention." And so they wanted someone to talk about fall prevention in dementia to caregivers. So
oh,
I I had to just do a little bit of studying, and I was the
I'm
speaker.
so glad you said that, Consuela, especially the fact, that you said you were a little shy at first, because, yeah, that's my thing, like, what do you call it? Projecting myself and my worth towards other people. It's a skill, I mean, you're marketing yourself, and I know what I'm worth inside. It's just giving it out to other people. And I'm so glad you said about going to the networking events, because it's exactly what I'm starting to do. I,
Yep.
I have my calendar
Well,
full now.
Well,
So,
there's a couple of things to think about. One is we know that it's 7 to 11 touches now before someone really has engaged with us. But the other thing is it's not always selling. People want to know that you care and you're
Yeah.
listening, and then you
mhm,
need to formulate what you're doing to solving their
Yeah.
problem.
Mhm.
And
okay.
so thinking about going to network events, you may be shy and not pushing, but you're asking questions about what
Mhm.
they're doing and what
Mhm.
their issues are and where their stuff is. And so that's the key component of this. And I'm going to go back to this also resembles the process that Consuela was talking about with clients when you're recommending changes in the home, because
Hmm.
you're engaging them with the same thing. Let's talk about what the problems are, where things are, and then kind of then having that joint problem solving. It's the same when you're approaching people when you're networking, right?
Mhm.
It's
Hmm.
like, where, what are you doing? What are gaps are you finding? Where are the issues? What are the things? And then thinking about, how does what I do help solve that? Or how does someone I know that I've connected with as
Yes.
well
Hmm.
help fill that need, right? And so it's not a matter of always being out there, sell, sell, sell of ourselves, because when we do that, people get cheesed off.
Right. Hmm.
Yeah, yeah, exactly.
Yes.
Mhm.
Hmm.
And so that's kind of the key. All right, any closing thoughts?
I would just say this, just get started with what's in your heart. If you'd asked me in 2021 what that I would have a nonprofit today, I'll be like, a non what? I don't want a nonprofit because I want to make profit. I need to get paid. I need to, I need to survive. It was just that my understanding of not, and I didn't think that actually, but that in a joking way, saying that, but it was just taking a step towards something that is like pounding at your heart that I need to do this. And I think that's where in life, how we, if it was dropped in our heart, everything that we are put on this earth to do, we would run the other way and get on the rock and just not, and be paralyzed with
If
fear.
we knew it all at once,
Do it
right?
all at once. It just takes an act of faith of taking the first step. It probably was never meant for me to really have an LLC. And I'm not saying I wasn't. And I love that part. But when I get a call, I'm really like, is this somebody about the nonprofit? Because look, that's where my heart is. Um, and knowing as it becomes established, then it becomes lucrative then in the way of I can do this and not have to try to balance two things because I can make this work as the I can put all of my focus here because it's meeting my personal needs too, as well as helping me to meet the needs of others. So if we can leave here with just thinking whatever it is in your heart you have to do is probably more. And I bet Sue is doing a lot more than she thought she was going to be doing 40 something years ago or 30 something years ago.
30, 46 now.
It's just starting where you're at and getting comfortable there, but not staying and just taking those next steps because everywhere I've been, when it becomes uncomfortable, then it's time for me to do something a little bit different. And I still haven't mastered part B, and I will probably be seeing Sue for that because I'm still have a lot. It's just different from home health. And
Yes.
but I'm open to the challenge of looking more in that direction too.
Well, I'm very proud of you, Consuela, because you have spent the time to know your community. One, you've been
Yeah.
engaged in it consistently for so
Mhm.
long. Then you've taken that to, how can I serve that community
Yes.
in a way that is sustainable and brings not only joy to me, but brings results to that community. And that's been really important. And that's all something we can do whichever way we're serving.
Mhm.
Yeah. So thank
Thank
you
you so
very
much.
much.
You're
Yes.
welcome.